thinking about how you bring yourself to work. And so the same things that get us into trouble in general society, I think, get us into trouble in the medicine. And I'm glad we're finally starting to talk about it and recognize it.
And what more people are just starting to recognize is
straight ahead.
that most chronic health conditions are rooted in other disparities throughout the African American communities.
When you see an obese kid, someone's like, oh, it's that parent's fault. They're letting them eat all that food. Really? Or is it the fact that there are no grocery stores in their neighborhood where they can get fresh produce?
She says she's most troubled by disparities in caring for the poor, especially children, as so many more people find themselves jobless now.
Where hospitals feel as though they're offering something to the poor by giving them, quote, free care. But that free care is delivered by doctors in training. It's not right. And to justify it by saying, well, without us, they'd have nothing, it's not okay. That's something I'd like to see changed in my lifetime.
Dr. Stanford and others are not waiting for the system to change overnight. That's not going to happen. We're going to show you what she's up to in a moment. But first, why is it that black men in particular won't go to the doctor?
The fear is that I don't know if I can really trust the doctor. Are they going to tell me the truth? Are they going to give me something that is really just to hurt me versus to really help me? Because I think a lot of African American people, and men in particular, just don't fully trust the system.
Fear, trust, and history.
We've always had that problem with trusting others with us.
They'll do more for the white folks than they would do for me. You know, being a black man, and we might have the same elements.
We have that history of, Tuskegee experiment.
The government-run Tuskegee syphilis experiments, 4 decades long, just ending in the 1970s. It still stands as one of the most inhumane and damaging acts of cruelty, not only on the all-black male participants in the study, but to their families and community, after those from whom treatment was withheld unknowingly spread the venereal disease with devastating consequences.
They were tricked, and put into this experiment. And as a result, there's a belief that the system will always trick you, use you for your life for somebody else's good.
On the other hand, licensed marriage and family therapist George James says he hears plenty of unfounded or misguided reasons from black men who just won't go to the doctor. Things such as, what I don't know won't hurt me.
I mean, I feel as though, it's not necessary, but when I need to go, I can go to the doctors.
It might be too late.
Yeah, but that's how we was brought up.
Why?
Don't cry. If it don't hurt, don't tell nobody.
The trade-off is a chronic condition, permanent damage, early death.
We only got one life to live, man. You gotta preserve your body. Like our body's like a car, man. If you don't do maintenance on it and take care of it, what you got?
What you got is trouble. Well, a whole new generation of medical professionals is moving in to keep some of these cycles from repeating. The young black doctors who are inspiring a movement and saving lives. Those stories next. The horror stories of how disproportionately the coronavirus is hitting the black community. And we hear the underlying health conditions and the lack of access to testing that may be the main reasons. But one local doctor wasn't buying it. She set out to reach the so-called unreachable, where they live and worship. The Jabba family offering their blood to test for possible coronavirus antibodies at one of the Black Doctors COVID-19 Consortium test sites.
We found out about the antibody possibilities, so we wanted to see if we can help.
Yao Jabba brought his wife and 3 children to the Black Doctors back in May to be tested for the virus.
We unfortunately, the whole family got corona. So we know what it's like, and if we can help people, that's what we want to do.
The Jabbas are among the first in the next phase of pediatric surgeon Ayla Stanford's mission to just make sure the most vulnerable, disproportionately affected among us get access to testing, treatment, and a fighting chance to survive COVID-19.
On average, we do about 50 to 60 an hour, depending on how busy.
It was busy on this day, hosted by the Baptist Worship Center Church. The doctors closing in on 10,000 tested since mid-April, all free of charge.
It's because we are empathetic, and because we listen. We have a shared cultural experience with them, and because when they see us and they can see us eye to eye, that we care, and we're genuinely here because we want to be here.
Driven to be there over what she says are nothing but excuses used by too many healthcare professionals for just about every disease and condition before COVID-19, sickening and killing Black folks.
Black doctors do care about the communities of Black communities.
This helps for me because I don't have health care. I don't have health care. I'm out of work. I went out of work to care for my mother.
And people should come out and be tested.
Even people with insurance said they had been told to just get on a list elsewhere and just wait.
Yeah, just get it done. I haven't been able to get it done. That's why I came.
I trust it. Why not? You know, and I trust her. So that's the most important thing to me.
What is that? Yeah. I don't take that for granted, and I don't take it lightly.
Neither do Mayor Kinney and Philadelphia Health Commissioner Thomas Farley, who recently granted the consortium more than $1 million to help pay for continuing this and future projects.
It took a little longer than I would have liked, but I'm glad we're here standing in this parking lot today and moving forward. This is the first organization that we have agreed to provide funding to for testing.
Before that, all this was paid for mostly out of Dr. Stanford's pocket. And all of these certified healthcare professionals volunteered their services, day, night, weekends, no matter what the weather. As a result, it is energizing other members of the Black community, professionals, church and community leaders, and lots of regular folks to take action.
You just can't sit back, you gotta do something.
I want to do it until you don't need me anymore. And then when you don't need me for COVID or for vaccines, then we want to focus on those other screening conditions that we've been talking about, the cancer screening, better control of the diabetes, nutrition, tension, prostate cancer in men, my goodness, all of those things.
One other thing is routine eye screenings and treatment for the conditions that are robbing African Americans of their sight. Next, a patient who waited until it was almost too late, now joining forces with next generation doctors working to change things.